All right, guys, welcome to the first Blaze Camp scientific review. Today we'll be talking about GLP-1 receptor agonists. What are those? These are weight loss drugs or drugs for type 2 diabetics, and they're all convoluted right now as far as how to use them, but they're very popular. So we have to make a video about them because it has changed the game. The world of weight loss will never be the same after these become more popular. So let's get right into it. First thing that I want you to know is that the table of contents is we'll be talking about opening your mind. We don't want to be biased. We'll be talking about what problems were they trying to solve when they created these. What is GLP-1 or receptor agonist as well? What was the problem when they first came up with it? How did they solve for those problems and how did they develop them into trials? Then what did the data find after they did the trials? We'll talk about some side effects, and then we'll talk about Blazecamp's opinions on its usage. I have a bonus for you at the end, so we'll add that too as well. But let's get right into it. Introduction, no bias. We're going to dive into the world of weight loss drugs and type 2 diabetics, specifically GLP-1 receptor agonists like Semaglutide, Ozempic, and such. Now, many of us have reservations about pharmaceuticals, influenced by concerns about side effects, narratives about big pharma. Like you've all seen the big pharma movies on Netflix, so I'm sure you guys have some type of bias about it. Or the belief that taking medicine is a sign of weakness or failure. I know a lot of people that believe that. These biases, while we understand them, they can prevent us from seeing the full picture and appreciating the scientific advancements that improve countless lives, okay? So just make sure that you don't carry a bias while we present all this information to you so that you can learn something about all these advancements in science. Today, I invite you to set aside any preconceived notions you might have about drugs and pharmacology. Let's approach this topic with curiosity and an open mind. Our goal is to explore together now GLP-1 receptor agonists, born from decades of research and innovation, offer not just hope, but real tangible benefits to those struggling with type 2 diabetes and obesity. By the end of this talk, I hope you'll gain a new perspective on these medications, informed by science and empathy rather than fear and skepticism. So let's get into it. Disclaimer. Please note that I am not a medical professional. The information provided in this presentation is for educational purposes only and should not be construed as medical advice. Always consult a healthcare provider for medical guidance tailored to your individual needs. Okay? What problem were they trying to solve when they were doing research in pharmacology about this information right here? Well, the first thing we needed to know is that the goal was to improve blood sugar control in type 2 diabetes without the downside of insulin therapy. So insulin therapy can be very highly calculated when you're trying to take insulin. It's problematic to a lot of people just to get the right dosages and have to inject yourself all the time, all these things. So they were trying to come up with another way or another answer to the insulin problem. The challenge is that they need for a treatment that mimics the body's natural glucose regulation mechanisms, okay? Because if you don't mimic the natural responses of the body, you might risk having hypoglycemia and so forth, or weight gain. So that was the challenge in finding another way of doing it, okay? In weight management, they're looking for addressing also obesity, which is a part of, or is commonly seen in people with type 2 diabetes because it's something that comes with also some type of metabolic syndrome or the habits that you have and so forth. So they wanted to influence appetite and satiety so that people can control their calorie intakes and so forth. That will help obesity, which will then help with in theory, which would have helped into type 2 diabetes. And then a sustainable treatment. They wanted something that was sustainable, something that they can develop longer lasting diabetic medications to enhance patient adherence and overall treatment and the effectiveness of that treatment. They wanted to be long lasting because it worked, right? Now, what is GLP-1? GLP-1 is a hormone. It's a natural hormone that your body already has and produces, a hormone made in your gut. When you eat, blood sugar comes up and then it helps control it. How does it help control it? It increases insulin release when you need it. So you eat, your body's glucose is up, and then the GLP-1 tells your body, yo, we need more insulin. All right. So it also helps with appetite regulation. It helps you make sure that you feel fuller for longer, reducing how much you eat. So it'll slow your digestion, and then what happens is that you will feel more full. The idea with this is what we'll talk about later when we talk about the fact that people lost weight when they started doing this. So keep that in mind. That's the next one, the weight management one. Okay. So because of the appetite, people ate less. All right. Beyond diabetes, research shows that it might also have benefits for heart health. That is crazy. So these are some very, very awesome things from GLP-1. Thank you, body, for being so perfect, right? Now, the problem, when they started using GLP-1 as far as the hormone of itself, they grabbed the hormone and they started infusing people with it, and then they started trying to enhance it, but they found a problem. Okay. The problem with that hormone is that it gets broken down too easily. Okay. So the GLP-1 was quickly degraded by the enzyme, DPP-4, making its effective duration too short. So they had a problem, which was, number one, if I give diabetic patients this drug or this hormone, what's going to happen is the body's going to break it down too rapidly. So we have a problem. Number two, it was tricky. It was hard to find a simple way to give GLP-1 to patients and figure out the right amount to use. Because again, we need to mimic how the body naturally produces insulin. So that was a secondary problem to the original. Number three, the safety. They got to make sure that it's safe. One of the questions that I had was, if you give me GLP-1, the drug, and I take it, right, will that make my body not produce as much insulin later? Will it affect my pancreas because my body's producing more? Because there's a lot of fear in how you regulate insulin, as far as will your body get used to it and then your pancreas will not work as much? That's another problem. So they had to look at the safety mechanisms and understanding. Comprehensive research was needed to fully understand GLP-1's actions and to establish a clear safety profile for its use in treating diabetes and obesity. What just happened? The solution was a Gila monster? A Gila monster? Yes. Crazy. Serendipitous. A doctor in New York made an interesting discovery when he saw that the venom in a Gila monster had a similar molecule to that of a human. The Gila monster venom contains a substance called exendin-4, which is not a GLP-1 hormone, but it's similar. So exendin-4 mimics many of the actions of GLP-1, including, here we go, stimulating insulin release in response to elevated blood glucose levels. So let's go back for a second. Pause. Your body has a natural response when you eat of sugar that elevates insulin so it can regulate the sugars in your body for you to use it as energy. This little monster here in its venom has something like that also does that. It helps, it tells the body release some insulin so we can go ahead and take care of these sugars, okay? But unlike the human GLP that we talked about had a problem, remember problem number one, that was quickly degraded by the enzyme, meaning that hormone was eaten too quickly. This little guy right here, the exendin-4 is not rapidly degraded by the enzyme, making it more stable and longer lasting in the human body. The stability makes it an excellent template for developing GLP-1 receptor agonist drugs for treating type 2 diabetes. Basically, the molecule that was the hormone that we have, the body intakes it and eats it real quick. But in the venom of this little guy, there was something similar. And then researchers thought, well, what if we make a synthetic version of our GLP-1 molecule, but we made it stronger by making it similar to the one that this little guy has on the venom, which was insane. That is some architectural advancement in science of molecules and just crazy science, right? So this is great for us. So what's the timeline on that? First, in the 1980s is when they discovered GLP-1. Like, wow, this is a product of the pro-glucagon gene and recognizes potential in regulating blood glucose. That's good. That was the 80s. The 90s, they started developing, and Dr. John Eng discovers the exendin 4 in the Gila monster venom. Okay, 1992, potential GLP-1, now that it's been synthesized and it started to be created in a different way to manage diabetes and obesity, begins to be more widely recognized and explored. In the 2000s, the first receptor agonists come out. Okay, that's when the FDA starts to look at it. That's when clinical trials start. 2010, now we have new discoveries. The FDA starts to approve new advancements of these drugs, and they are producing patients with different dosages. And then finally, 2017, semaglutide or Ozempic is approved, showing even greater efficacy in blood sugar controls and weight loss, followed by its oral formulation in 2019. 2021, semaglutide received FDA approval for chronic weight management, making it a significant milestone in leveraging GLP-1 receptor agonists beyond diabetes treatment. So, yes, it has been approved for weight loss or chronic weight management, okay? The results of those trials. Number one, people lost weight. In the STEP trials, people using semaglutide lost about 15 to 18% of their body weight in over 68 weeks. Notice this, because a lot of people that I've been talking to that come into the program to try to lose weight, they say they've tried semaglutide or Ozempic for 1 or 2 months and it didn't work. And that's not how the drug is supposed to be used. So if you think that you're just going to take it for 1 or 2 months and it's going to be magical, that is not the case. That's not what the studies did. The studies started doing from 16 weeks and on, they started seeing all these changes, some behavior changes and so forth. So this is an example of a 68-week study. Number two, controlling diabetes. In the Award 6 trial showed dulaglutide effectively lowered blood sugar compared to insulin in diabetic patients. That's super interesting because that's what it was made for, but it's interesting because of the fact that it's doing different things in different trials that are good results for people, okay? And number three, which is the craziest one, and we're still studying about it, is the heart health. In the LEADER trial, they found that liraglutide decreased the risk of major cardiovascular events by 13% in patients with type 2 diabetes. Remember, we spoke about type 2 diabetes being tied into things like metabolic syndromes and things about your habits and the way you treat your life. So these are all correlated, and they usually come into the same box for people that are out of shape and they're just not treating their bodies as the best possible scenario that they could. So it's also in the SUSTAIN 6 trial observed that semaglutide reduced major cardiovascular events by 26%. These are amazing results. This, in the weight loss community, there has been a lot of supplements that none of them give you this type of result. There has been a lot of systems that none of them give you these kind of results. The best way to do it, okay, as far as if you want to transform your life, is that you got to evaluate where you are in our quickly spectrum that will tell you at the end, as far as how much you need it for your health and then how much of cosmetic you're looking for, okay? We'll talk about that later, but these results were amazing out of the drug. Now, I understand that you also want to look at, well, what were the side effects? I'll tell you about the side effects. Number one, gastrointestinal issues. Common side effects like nausea, vomiting, diarrhea, and constipation. These effects typically mostly pronounced when therapy is initiated and may decrease over time. What does that mean? That means people started taking it and then they started getting all these things, and then over time they started to go away. There is a lot of people taking these drugs street style, that they go in someone that's, I heard of a lady that's doing nails the other day, and the lady that's doing nails has somebody in another office, like in the back office, that also sells semaglutide. And this person injected the semaglutide and got the injections there by this person that was not a medical professional or anything in the back of a room somewhere here in Miami. And what happened was that that person was not getting any results and they didn't feel anything. And you could just be getting injected with water and you don't even know, because you think this is going to be something as simple as getting in the back room somewhere. And this is not how it is. you got to make sure you go see a medical professional. You got to make sure you invest the time and the money to go see a doctor and to make sure that you're doing it the right way. If you're getting these side effects, this is probably because, one, that's what the drug does and it's normal. You need to talk to your doctor about it. Or number two, you really need to go see a medical professional because maybe you're having an adverse effect and a problem that you need to fix. So just be careful. You don't want to waste your time. You don't want to waste your money. And least of all, you do not want to hurt yourself. Okay. Number two, another side effect is that people's appetite change. The reduced appetite is a common effect, which is generally beneficial for weight loss, but you got to monitor that. Why? Because you can go into hypoglycemia. Or you also have the effect of if the appetite changes and you're trying to gain muscle mass or you're trying to train really hard in the gym, that's not going to help you too much as far as energy volumes go. So just make sure that you understand the appetite changes are going to affect you according to your goals. Number three, people had reactions in the injection site. In the injection sites, people have a reaction whenever you do any type of injections that may happen. So some patients may experience redness, irritations, or pain at the injection site. Number four, risk of pancreatitis. Though relatively rare, GLP-1 receptor agonists have been associated with an increased risk of pancreatitis. Patients should be advised to report symptoms indicative of pancreatitis immediately. You have to make sure that you are under the supervision of a medical professional. I cannot stress that more than this because some of these side effects can be detrimental to you. So you got to make sure that you follow procedure. Thyroid C cell tumors. In rodent studies, rat studies, some GLP-1 receptors agonists have been linked to thyroid C cell tumors. So basically some cancer, but it's unclear if it applies to humans just yet. So as a precaution, these drugs are not recommended for individuals with a personal or family history of medullary thyroid carcinoma or patients with multiple endocrine neoplasia syndrome type 2. So that is outside of my scope of practice. That is something that, again, you will have to go see your medical professional. All right. Then, what is Blaise Kemp's opinion? I believe that you are not weak or a loser in any way if you have to resort to pharmacology in order to help you. Tons of people have a very hard time regulating hormonal signaling and things like their hungers. Their hunger levels are way too high. Sometimes it's hard for people to lose weight. You can't just tell them spinach and chicken and a little bit of rice, you'll be fine. Or give them some type of thing like just go keto and it'll go away. Some people have higher signaling levels as far as hunger and as far as not being able to control themselves. And I understand that it's something that you can work with in the mind. And I understand that it's something that you got to work with in your fighting your genetics of how maybe you have it in your family as far as how much they fought against being obese. But I do want you to understand that not everybody's the same. So if you have a hard time regulating hormonal signaling and things like your hunger levels, and at a certain point, you're falling behind in being able to control yourself in any way as far as your weight gains and things like that, I believe this might help. Again, this is something that you will have to consult with a medical professional and maybe even get yourself a coach that can help you understand that these drugs are not a solution that has magic and is going to make you eat healthy from now on. If you take the drug and you eat less and you lose weight because you ate less, you still have bad habits with your eating, you're going to hurt yourself because it's going to hurt you in your stomach. You might have more gastrointestinal issues because of eating the negative type of foods that are not going to sit well with you. Also, as soon as you get off the drug, everything will go back to you gaining weight because you never applied yourself to learning new habits. So the drug is not going to change your habits. The drug is not going to make you smarter as far as how you treat your nutrition. This is very important that you understand that. So we've put together some kind of moral hierarchy on the subject according to our views so that maybe you can evaluate if this is something that you want to do, or if you're doing it, where you're at on it, okay? Our moral hierarchy goes from more superficial needs, which is less medical need, all the way down to deep physiological needs, more medical needs. At the bottom of that pyramid, the deeper physiological needs, people that really need it for their health, more medical needs, are people with type 2 diabetes. That is essentially the bottom line, that you will need it for your health. and people with severe obesity. If you are struggling with severe obesity, if you're struggling with type 2 diabetes, this is something that you can talk to your medical professional because you need it. You might need it. You need it in making sure that you understand if it'll help you. So you have to talk to a medical professional. This is more of when we talk about morals. At this point in time in that pyramid, this is not about morals. This is your medical needs. Okay. In the middle of that pyramid, we talk about general population that needs additional weight loss support. So this is something like if you just came out of, you're not morbidly obese, but you just came out of your higher BMI and you want to help yourself get into healthier ranges, then you might want to do it. You want to talk to your medical professional again and your coaches to make sure that that's something that you want to do. Again, is not going to help you sustain a long-lasting behavior change. So the behavior change that's more cognitive, you got to make sure you understand you want to learn how to live a life without the drug, okay? Then after that, seeking lifestyle changes in cosmetic and casual use. These are people that they want to change their lifestyle, like they want to get shredded, for example. Cosmetic use is about the same, or casual use, people that just want to do it over after winter and they want to make sure that they are shredded for the summer. Or people that are like actors or models, things like that. That's more superficial needs. That is less of a medical need. So that is something at the top of the pyramid. I'm not going to say is morally wrong or right, but the behavior tends to be the person that has a less medical need. And then at the bottom of that pyramid, who really needs it? People with more medical needs. I want you to understand that it's not necessarily wrong that a person wants to use it for cosmetics. I just want my views and my opinions to be part of this video, and I have to share them with you. If you're doing it for cosmetics, for less medical needs, more superficial needs, more like you're seeking a lifestyle change, I want you to know that it may hurt you. It may hurt you to put a crutch on yourself on the levels of potential that you have. So if you happen to want to take the drug and you never fight against some of those behaviors, then you're always going to have to be accepting the fact that you're not strong enough to keep working it on your own. So just make sure that that doesn't bleed out into everything in your life. And last but not least, we'll talk about myths and conclusions because we're done with the video soon. Myth number one, GLP-1 receptor agonists are just for weight loss. The truth is, while these drugs can help with weight loss, they are also crucial for managing type 2 diabetes by improving blood glucose control and have been shown to provide cardiovascular benefits. Amazing. Myth number two, once you start taking GLP-1 receptor agonists like semaglutide, you can't stop. Truth is, they can be discontinued if necessary. You don't have to take them forever under a healthcare provider's guidance. The goal is often to use them as part of a broader strategy for long-term health improvements, which may also include lifestyle changes, which we just spoke about. Number three, GLP-1 receptor agonists have severe unavoidable side effects. While side effects do occur, they are not inevitable for every user and often diminish over time. A lot of those side effects just go away little by little. Many users tolerate the medication well, especially when they start with a lower dose that's gradually increased. If you talk to your medical professional, they will let you know that you have a little bit to take at the beginning and then you try it, so you make it a little bit more. Just stick to that every 4 weeks around such you stay around the same dosage because it takes about 4 weeks for the drug to actually be applied and being used at its full potential in your body. So let's say you start at level 1 for 4 weeks. Then if you see that you're still hungry, still eating the same, you're not getting any benefits, then your doctor or your medical professional will go ahead and allow you to take a little bit more. So then little by little, what's going to happen is you're going to find how much dosage your body needs. So it's gradually used over time. It's not just, I'm going to put the max dosage and go. That can be detrimental and that can give you a lot of the side effects that you might have felt. A lot of people have come to us with that. I took it. I had terrible stomach aches and I couldn't keep taking it. And then we asked, well, how much did you take? Well, I took the max dosage. Like, that's not good. That's why you probably needed a hospital. Okay. It also slows your gastric, so when you're eating the food, for your food to be digested, it'll slow that down. So you won't be able to digest the food at the same speed. So that's going to be a problem if you're taking very high dosages and you didn't gradually move up on it. Myth number 4, if you're using GLP-1 receptor agonists, you don't need to diet or exercise. That is a lie. Diet and exercise remains crucial components for managing diabetes and obesity. GLP-1 receptor agonists are most effective when combined with lifestyle changes, because then you won't need to be spending money on the drugs if you already changed your lifestyle and you brought your health back to optimal. That'll be great for you. Myth number 5, GLP-1 receptor agonists work the same for everyone. Individual responses in these medications can vary. Factors like diet, exercise habits, and other health conditions can influence their effectiveness. So it's not the same for everybody. We have clients that have lost a lot of weight, a lot of body fat, and have maintained some muscle mass amazingly well. And we have also had clients on the drug that have done nothing for them. So I want you to understand that this video is informative. I hope that this helps give you a rundown on the science of GLP-1 receptor agonists. So in case you have any questions, write them down in the comments or just send me a DM or send me a message wherever you can find me, Instagram, wherever. The idea of this is to try to bring you as much science as I can to help you understand what it means to study these things that are coming out in the world. We don't want to stay behind as far as information. We want to be up to date with everything. There's a lot of research on this. I invite you, if you can, to take a look at it. Thank you very much for your time. Make sure you like, comment, subscribe, and share it with friends and family members. And if you're listening to this, I do want to let you know, thank you very much for everything that you're doing for us and everything that you're listening to. And I love you guys. Thank you. Appreciate your time.